Austin and Travis County health officials are looking at data to decide whether to move into stage 5. That is the highest level of COVID-19 community risk. And with that could come stronger guidelines about how to stay safe. Senior reporter Tony Plohetski is live outside Ascension Seton Medical Center in central Austin, which is feeling the effects of this COVID-19 uptick. Tony, correct?
Mike, they sure are. Hospital capacity as well, Mike, as the number of people in ICU are major factors that officials will be considering whether or not we move to stage 5. Keep in mind, we're going in the wrong direction here. We were at stage 3. Then on June 15th, we moved to stage 4. Now, of course, on the cusp of stage 5. In stage 4 restrictions, again, that's where we are right now. Lower risk people could still go to reopen businesses, but we're encouraged to avoid social gatherings of more than 10. Also, under the current stage 4, those who are older or had existing health conditions were encouraged to avoid going to businesses unless it is essential and to avoid gatherings of more than 2 people. In stage 5, everybody, both healthy people and those with medical conditions, are asked to avoid social gatherings and only to do essential business.
It's primarily based upon the rate of hospitalizations, the new admissions, but we also realize that right now the pinch point seems to be our ICU capacity. So we're looking at models related to ICU capacity and whether or not we're within 2 or 3 weeks of exceeding that capacity. If that's the case, then we'll need to make the decision to have further restrictions.
Health leaders said today that right now we are averaging more than 70 new admissions each day. And under the guidelines, that is the threshold for stage 5. Stage 5 happens when the local hospital system agrees or sees a rolling average of more than 70 patients admitted per day. Right now, again, officials say we're hovering around 75. Again, these are recommendations and guidelines. Officials have continued to stress, though, that they may make recommendations to the governor's office to put stronger mandates in place here locally, especially if our numbers do not start moving in the right direction. Reporting live from Central Austin, Tony Plohetski, KVUE News.